Good morning. It is Wednesday morning, June 23, 2021. A quick shout out, happy birthday, Mom. But for the rest of you, this is the first film we've done, the first video we've done in the summer. Yeah. So this is officially summer as of last week. So hope you're all enjoying the beautiful weather we've been having. Gary and I are back with a variety of topics today. Let me start off with one that's relevant to everybody in the offices, and that is, as you've been notified via email and so forth, we have really cut back on our screening. We have shut all of our major vaccine clinics, of course, and our screening, you will notice, is no longer happening at the front door. Way it's working now, and the reason we're able to do this, and this is basically what we're doing now, is getting away from the sequestered environment for those people we think might have COVID. And the reason we're able to do this is because we feel like we're really in a safe environment now. And a couple things that make that relevant is, one, the vaccine rate here in Sonoma County is we're basically up to herd immunity. And secondly is the data you pointed out on our last video, a big study in the MMWR that looked at, what was it, 100 million doses of the vaccine, and they studied those people who broke through with infections. And Gary, I had to write down the numbers. For those individuals who broke through having had the vaccines that we're receiving, the risk of being hospitalized was 0.00098%. The risk of dying was 0.00015%. So we're functioning in a very safe environment. So that's what gives us the confidence to do what we're doing. So the plan now is that when patients call to make an appointment, if they have symptoms suggestive of COVID, they will be redirected to same-day care. If they go online and make an appointment, they will be screened likewise. But if people make an appointment and come into the office and they have passed through those screenings, they'll be self-screening. There's posters at the office for individuals before they enter the office. If they have symptoms that trigger the screening protocol, they have a phone number they will be calling to a PSR inside your office. PSR will come out and escort them to a room in your clinic. Now, bear in mind, according to state protocol and Sutter protocol, everybody in our offices, in our clinical offices, is still required to wear a mask, including the patients. So this individual who maybe, let's say, has developed a fever that morning and they show up at the office, we can see those people. So they will be escorted directly to a room by a PSR so that they're not touching handles and elevator buttons and that kind of thing. They will be checked in as usual. You will go in and do your usual evaluation. We're all wearing the same things. The suggestion is that you wear an N95, which is freely available in all of our offices for these specific patients. You're going to be wearing your eye gear just like you are doing now, so nothing's changed there. You're going to conduct your evaluation. If you deem this person needs a COVID test, then the new thing is you'll be able to draw that test in. So we will not be necessarily sending people out. It's not necessary to send people out for tests, as we can do it in the office. And that is simply done, since many of you have not worked in the respiratory clinic, it's fairly simple to collect a COVID sample. So we do a middle turbinate swab, so that's kind of deep. I'll practice on you, Gary. Which side do you want me to go? You take one of these big ones, and no, just kidding. So the offices will have swabs that are available for this. And actually I have a slide, next slide, that shows exactly what is involved. It's just simply a matter of tipping somebody's head back, inserting the swab, kind of say roughly parallel to the palate, drop it in about an inch, give it a few swirls, leave it in about 5 seconds, and then direct the same thing on the other side. And then put that into the vial. No longer needs to be triple bagged like it did before. Simple one bag, and the PSRs will send that off to our Sutter shared lab. In this situation, we know already from our community surveillance that there's a 97 to 98% chance that this COVID test will be negative. But all the same, when the patient leaves, you should tell them that they should isolate at home until you have the results the following day. So really, we're feeling it's a safe environment, getting life back to usual, and it shouldn't be that big of a deviation from what we've been doing. So that's all news, and I hope it's going to work out well for you. I'm told that the offices are getting all the supplies they need for the testing, and it should be pretty straightforward. So let's switch to some different topics. Here, I was reading in the paper just a couple days ago that the Delta virus has hit Sonoma County. So what can you tell us about the Delta virus?
Yeah, the Delta strain is really in the news now, both locally and both in national and international news. I want to show you a slide just to show you kind of all the variants of concern. These are CDC recommendations, and there's a lot of different names. And so you'll see there's a variant name. The Delta virus is B1617.2. Its country of origin is India. The WHO wanted to name these alpha, beta, gamma, and call this Delta so that countries wouldn't be profiled. What we know is that, for example, the UK strain, the B117 strain, which is called the alpha strain, was probably 50% more transmissible than the standard strain that was circulating in the world. And there were some increased hospitalizations, increased fatalities, and tracking a number of the mutations here. If you drop to the bottom of this table, it shows the Delta strain. The Delta strain out of India is 50% more contagious than the UK strain. So it's remarkably transmissible. It's increased virulence. We clearly know there are more hospitalizations and more fatalities with it. And we're seeing that in certain countries. The fortunate information is that in the US, the mRNA vaccines, Pfizer and Moderna, are holding up very well against the Delta strain. And so we probably have lost only 10% of our effectiveness on these vaccines to the Delta strain. So that takes us from the mid-90, 94, 95%, somewhere in the 80%, 85% range of effectiveness. So we are fortunate to have probably the best vaccines in the world, serendipitously, that are stacking up against the Delta really well. Other countries are not faring so well, and I'll show you a couple slides for that. Here's Russia. Russia's going into the third wave because they developed an adenovirus vaccine, called it Sputnik, and then it was called Putin after himself. But Russia actually put out a vaccine that had not been tested yet. It had not been studied. So they sort of jumped the gun. So before all the research had come in, they released the vaccine to the country, and this adenovirus platform is not holding up very well. Because of that, the predominant strain in Russia is the Delta virus, and the vaccine's not effective enough, and they're having a lot of new cases, hospitalizations, and deaths. The UK, which was really adamant about using the AstraZeneca vaccine because it was developed at Oxford, the UK is delaying opening the public for another month because the Delta variant has become predominant there. So the UK first had to deal with the UK strain, B117, now they're dealing with the Delta strain. Many people think the Delta strain is going to be the predominant strain in the world. It's certainly because of its transmissibility and some viral fitness, and it's going to be a little bit more virulent. I think that for the Pfizer and Moderna countries using those vaccines, the Delta strain is not really more dangerous. I think it's just going to be more transmissible. But I think for other countries that are using vaccines that are falling apart, for those countries, the Delta variant will become more dangerous. So if you're not vaccinated, the Delta strain is really an important thing. If you are vaccinated to the Moderna or the Pfizer vaccine, I think the Delta strain is going to be more of a nuisance. But it does mean we really do have to reach herd immunity. And I think that's going to be very important. I'll show one more map just because we've been talking about this country for a while. We're following Brazil for a number of reasons. Brazil is really struggling. You can see that they really haven't locked down their virus at all. Brazil is also seeing cases in young people and also in children. So we're following Brazil very closely because the P1 variant in Brazil, which is going to be called, and I'll tell you that because I have it memorized these. The P1 is a gamma strain. So in Brazil, we're following the P1 very carefully to understand if it's different in children. So I've been really keeping an eye on that to make sure there's going to be no changes in our recommendations as we're trying to get kids vaccinated now.
And Gary, what are we seeing at the hospital? So we've kind of reached herd immunity in the adult population, although those numbers go down to age 12. What are you seeing in the hospital? Are you?
Very little. So I've had a couple calls from the ER about people who are coming in with very mild illness and they have some high risk factors. So we've been giving them Regeneron monoclonal antibody, but we haven't had someone hospitalized in weeks. So it's been very quiet in the hospital. We're seeing a little bit of outpatient, but not hardly anyone hospitalized, and it's clearly been quiet. So it's been more business back to normal in the hospital, which is good because the hospital teams in the ICU, they're getting their feet under them again because it was a really rough year.
And is it still fitting the bill that those people are getting infected by and large are non-vaccinated individuals?
Yeah, I mean, 99% of people who come into the hospital, especially if you have moderate to severe illness, are unvaccinated. That's the rule of thumb. It's the rare case where someone has received a vaccine. And if they have received a vaccine, oftentimes it's advanced age or immunosuppression that's leading to a poor vaccine response.
A quick thought I had is there's a little bit talk out there about a booster. Do you see a booster in the future?
Yeah, so that's a big question. First of all, we know that immunity from the vaccines lasts for a year or more. That's good information. A lot of the studies in the US, the FDA's told them you have to study these vaccines for 2 years minimum. So those studies are ongoing to see how people are doing, and the vaccines are stacking up really well. According to Anthony Fauci, if we need a booster, and it's a big if, we probably won't need one until next year. So it's anyone's guess about a booster. I think the vaccines are holding up really well, even against the Delta virus. Just because that strain is out doesn't mean that it demands a booster now as well. So no one really knows if we're going to need a booster. It's anyone's guess. But if we need one, and it is a big if, it wouldn't be till next year.
Okay. And I think I saw you had a map of Sonoma County with the distribution of vaccines.
So this is really fascinating. This came from the dashboard. So how's Sonoma County doing? 74% of people here are vaccinated. So we're really close to herd immunity, if not there already. And I'll show you these two slides. The first slide is a map by zip code, and it shows you the case rate. So this is where the cases in Sonoma County clustered. And you can see the brown is where they clustered the most, in the middle near Santa Rosa. Now compare that to the next slide. The next slide shows you where people have been vaccinated. And blue is good and brown is bad. So you can see on the brown, lower rates of vaccination in the West County, and some in the middle of Santa Rosa as well. And on the eastern part of the county, much more vaccinated. So it's interesting that it's a potpourri in Sonoma County, that we do still have some opportunities for vaccine, especially on the West County and spots within the Santa Rosa area. But I think that our vaccination rates are really high enough where I think it's going to be safe for us to do a lot of things that we all want to do, like going to the gym, going to the store, going to Costco.
Okay, thanks. Actually, last question, which we're now doing 12-year-olds. I assume there are ongoing studies for younger children, or can you comment on that at all?
Yeah, so the big news with especially males that are young is whether the mRNA vaccines, the Pfizer, Moderna, are leading to myocarditis. And there's a big ACIP meeting on this Friday, and also a big CDC conference, IDSA CDC conference on Saturday, about the myocarditis in kids. And so the risk is there's been about 300 cases out of 20 million doses of vaccine in kids. So the risk is very, very low. But what I'm worried about is that if we follow Brazil's variant, or if the Delta virus changes, will that become more virulent in children? And so there's also been about 4,000 cases of this pediatric illness called MIS-C, multi-inflammatory systemic syndrome, which has been very dangerous, where kids go through multi-organ failure and hospitalization. And so I think that the risk of MIS-C in children exceeds the risk of a vaccine. The cases of the 300 cases of myocarditis, which predominantly in males in a younger age cohort, everyone did really well. So everyone kind of survived and got back to normal cardiac function.
Okay. So once again, it sounds like the same message, that is, this is a vaccine preventable illness, and any risk of the vaccine is outweighed by the risk of the illness.
Yeah, absolutely. So I think unvaccinated, this is a dangerous virus, more dangerous than the flu. Once you're vaccinated, we go back to, now this becomes a race against the flu. The flu becomes more dangerous once you're vaccinated.
Good. Okay. Well, I'm going to switch gears and just, we are in the summer. We all know where we live, and I just want to be a little proactive about disaster preparedness. We have seen evacuations, we've seen fires, floods, we have potential for earthquakes. We have been through this enough times that we kind of know now how to keep the clinics running, how to continue to provide medical care for our community, but I'm concerned about our families. And I just want to bring this up to ensure that all of you are prepared as individuals and as families. So you will be getting an email from me in the next few days with a link at least to a Sonoma County site. There's a lot of information out there. This is a pretty useful site, and that's my next slide here, shows you what that web page looks like. And on that web page, there's a lot of resources that can help you become prepared as a family. The first one, everybody should be hooked up with Nixle alerts. There's links on this site to tell you how to pack your go bag, and you should make a list of what kind of things you would want to take in the event of an evacuation. There's a personal preparedness plan where your family talks about, all right, where are we going to go if we have to evacuate? Who are we going to stay with? How are we going to communicate? If there's multiple family members, where are we going to meet? That kind of thing. Just want everybody to be fully prepared. And of course, communication is a tremendous part of our ability to withstand this. And so Iz has sent out an email to all of you to update your cell phones and make sure we have an accurate list. And what's going to transpire in this situation, if this were to occur, is that we are going to ask all the site leads to check in with you. They'll check in with all the providers of their clinic. And this last slide generally shows you what kind of information they're going to want to get from you. First, we want to know if you're safe and that you've got a place to be. But then on top of that, are you able to help out to come back and help care for the community? So we'll be sending all this to you in an email, but I do want everybody to plan for this. In fact, my wife and I are driving to Oregon for the week of the 4th of July, and my son lives here in town, but what we're going to do is just pack up our stuff into the spare car, the van, leave it in the garage, give him the key, and say, if you have to go, just take that car, and we don't have to worry about all the stuff that is left behind, because we've packed the car before. We know what to do. So hopefully everybody be prepared, and in doing so, we're going to avert the possibility of we'll have to use all that. So that's all we have today. Welcome to the summer. Make sure you get out there, enjoy the summer sun, and hit the trails. Thanks.